Taking care of your health is important, especially during a pandemic. That means getting checkups and screening. So have you ever been tested for hemoglobin A1C? It is something that we should be screened for all the time after age 25. Our 9 health expert, Dr. Pyle Coley, explains why it's important.
Hemoglobin A1C is a blood test, and essentially what it tells us is how good our sugar control has been over the last 3 months. And the reason hemoglobin A1C is important is because it tells us whether or not we might have prediabetes or diabetes or be at risk for developing these conditions. Higher than 5.7% hemoglobin A1C, you're a pre-diabetic. If you're higher than 6.5% hemoglobin A1C, that gives you the diagnosis of diabetes. There's no compelling scientific data that being a diabetic or pre-diabetic actually increases your risk of catching the infection. But if you were to catch the infection, your risk of progressing to severe complications is very high. Many of the patients hospitalized with COVID-19 or passing away from COVID-19 are those with diabetes. There are many lifestyle changes you can institute to actually improve your hemoglobin A1C. So the first is to lose weight and exercise. The second is to get at least 30 minutes of cardiovascular exercise at least 5 times a week. And then the third is dietary changes that you can institute. So you really want to watch how many carbohydrates you're taking in, and especially those simple carbohydrates or refined sugars. Taking in fruits and vegetables are the good kind of carbohydrates. You can still continue to have those. Diabetes or prediabetes can often be asymptomatic, so you can have problems brewing inside with sugar control for many, many years before you manifest with symptoms.